So this is my patient Florence. Hi Florence.
Hello, Dr. Pam.
We started treating her 8 days ago when she came in between her sister and her brother who needed to practically hold her up. She was very crooked in her back and she had a lot of pain, so much so she could hardly crawl onto the bench to get treated. We all had to help her in fact. So I'll ask Florence to tell you a little bit more about how she became in that position and what it felt like. Off you go.
Alright, so I fell through the bicycle a couple of months ago, to be exact, around May. And I experienced backache and I went to an orthopedic doctor. He gave me some muscle relaxants, asked for an x-ray, and the treatment was done. After a couple of months, I'm still feeling the same pain. And I woke up one day that I couldn't stand anymore. So I could barely walk, as Dr. Pam mentioned. I couldn't assist myself to walk. So during that day, I took some pain relievers. To be exact, it's 400 milligrams, but it didn't work. If I could level the pain scale, it would be more than 10 because I could barely walk. So the next day, I decided to visit the clinic and I was treated by Dr. Pam. During the first treatment, I was so amazed because I was able to walk after the treatment that I had with her. And then I went for a couple more sessions. Actually, it's every day for an entire week. And I am amazed because I never took any pain medications, but I'm able to walk properly now.
What we did when you came is we treated mainly your pelvic problem because your pelvis was out of line, causing you to have this very crooked back, which is kind of hard to maintain, and the pain was travelling up your back gradually, but most of it was down in your left sacroiliac joint. How was the pain when I was treating you? I might have given you a little bit of muscular pain, true?
Not really.
No? Okay.
No. Good. Actually, I'm amazed because you're moving my back, my bones, but it's not painful at all.
Yes, when I did the adjustment on you, it's not painful, the adjustment.
No,
of course. But maybe when I press the muscles, sometimes it can be a little painful at the time.
You would say that you will just point something and then the pain goes away.
Yeah, exactly. I'm holding it, doing some treatment therapy. So you did very well, really, but you were a dedicated patient. You did everything I said outside the office. Yeah. When you went home, you rested, you walked, like I said. So it's pretty amazing that you've got better in 8 days.
Thank you, Dr. Pam.
And we're going to do another treatment today, and we're going to see how everything is. Good. Look at her posture now. This is something we didn't do much at the beginning because she could hardly move. And we can see that she still has a shoulder lower here. And this side of her pelvis is translated over to the left. So she's a little bit crooked still in this direction, but believe me, she was much worse before. She's compensating quite nicely now. We can see that the gaps between her arms are still a little bit off, so there's more space here, and this arm is quite nicely attached to her hip because the hip is over to the left side. And if I look down from here, she's a little bit forward on this side as well. So there's not only is there translation, but also a little bit of rotation left. But this is much better. This is called a functional short leg. And she's also got some more inversion of this foot, as you can see. This one is a bit straighter and this one is coming in more. So eventually we need to try to get this foot out a little bit like this, maybe with a little bit of exercise, a little bit of stimulation on the legs. When you first came, we could hardly even give any pressure here, could we? You were jumping.
Yeah.
So now, this doesn't feel painful, correct?
Yep.
Okay, so we've still got a little bit more movement on this side than we have on this side. And I want to just check how the spine is as we go up, so let's have a look. Painful? No pain, just a little bit of tight muscles, that's great. Paraspinal muscles and the lumbosacral ligaments here, a little bit tight, right? Mm-hmm. Yeah, a little bit of inflammation still in there, which might be what's keeping her a bit crooked. Okay, good. We're going to need to give you an adjustment here today. Possibly a bit of drop therapy on that leg. So simply with work on her muscles, we're definitely getting a much better balance on her leg length, so that we can show that that's not a real leg length difference. It's just a functional leg length difference. So here we go. Okay. That feels so good. Good. Let's get you in here. Okay. So we're going to do a little adjustment in your long low sacral junction, just here. Okay. Just remember you're going to be fine. Okay. Just let everything go. Good girl. Okay. Good. On your back. A little bit of tension up here. You feel it? Just in here. I'm just going to hold it. So how are you feeling? Any better?
Much better.
Good. So the pain's just gently gone away.
Yeah.
Good. To make sure you've got another little bit more movement in here. Okay. Good. Okay, now, so I want you to get up the way I showed you to, safely, the way everyone should get up, turning onto your side slowly, pushing up with your hands. That's good. And just wait a moment until you're off the bench, just to get back to normal, and off you go. Okay, so every morning when you get up, you're getting up that way, right?
Yes.
Yeah. This is
That was well fun.
Good. Okay, so we're just going to adjust this side where you've got this little complex section. Let it go over to the left as far as possible, and just